Okay, 360 of the room. And my rubric is right here. Okay, so we checked your vitals prior to the assessment. Everything is normal. And then we checked your cranial nerve 2, your optic nerve using the Snellen chart, and your vision is 20/20. Okay, so I want to come in the room, provide patient privacy, do my hand hygiene. Hi, I'm Jenna. I'm going to be your nurse today. Do you mind telling me your full name and date of birth?
Powell, 9/16/97.
Perfect. And then can I look at your arm band? All right. And then Kyler, do you have any allergies?
I do not.
Great. And then you've already told me your name. So Kyler, where are you?
At the hospital.
All right. And then why are you here?
For an assessment.
All right. And then do you know what day of the week is it?
It is Saturday.
All right. So Kyler is oriented to person, place, time, and situation. And then Kyler, how are you feeling today?
Good.
Good. You have any pain?
No.
All right. Perfect. So the first thing I'm going to do is just feel around on your face. Do you mind if I touch you?
Sure.
So just feeling here. The skin is warm and intact. The color is appropriate for his ethnicity. There's no swelling. Everything is symmetrical. All right, Kyler. The first thing I'm going to do is take a look at your eyes. I'm just going to shine this light so I can see the color of them. All right. Perfect. The eyes are symmetrical. There's no redness. There's no drainage. And then I'm going to take a look inside your ears. Perfect. And then on the other side. Okay. Your ear canals are pink and there is some cerumen present. Okay, next I'm going to look inside of your mouth. So, if you can open nice and wide for me. Perfect. The inside of your mouth is moist and pink. The teeth are intact and there's no bleeding of your gums. And then I'm going to look inside your nose, so do you mind tilting your head back? Great. All right, so the nares are patent and pink. Okay, so next I am just going to feel along your neck. So just feeling here. Your trachea is midline. And then if you mind facing that way, I'm just going to reach behind you to feel along your neck a little bit more. Okay, so right here. All right, and then can you swallow for me? All right. There are no nodes, and the thyroid is non-palpable. Okay, next I'm just going to feel for your lymph nodes. So first, that's going to be your pre-auricular. Then it's going to be your post-auricular. Then your occipital. Then your tonsillar. Your submandibular, submental, preclavicular, postclavicular, and supraclavicular. All right, perfect. Okay, next I'm going to listen to your carotid arteries for any bruits using the bell of my stethoscope. Whenever you feel my stethoscope on your neck, if you can just hold your breath. All right. Just gonna feel, make sure I'm in the right spot. All right, hold your breath. Perfect. And then I'm gonna do the other side. Just feeling I'm in the right spot. If you can hold your breath. Perfect. Okay, there are no bruits present. And then I'm going to feel your carotid arteries for your pulse, one at a time. Okay. Perfect. And then the other side. Perfect. Your carotid pulse is +2 on either side. Okay. So now we are going to go ahead with your cranial nerves. So, the first one that we are going to test is going to be cranial nerve 1, your olfactory nerve. So I have a couple things in my hands. I'm going to ask you to plug one of your nostrils and smell with the other and tell me what you think it is.
Sounds good.
Okay, so if you can close one nostril. Okay, can you smell this?
Yes.
Okay, what is it?
A mint.
Perfect. Okay. And then, yeah, you got your other nostril. If you can smell this,
Yes.
what is it?
Alcohol swab.
Perfect. So your cranial nerve 1, your olfactory nerve is intact. Okay, I have another look at your eyes. I'm gonna dim the lighting. And if you can just stare at the wall. Alright. Perfect. Right. Okay. Your pupils are equal, round, and reactive to light and accommodation. That means your cranial nerve 3, your ocular motor nerve is intact. Okay, now, if you can follow my pen with your eyes and try not to move your head, just move your eyes only. Perfect. All right. That means your cranial nerve 3, your ocular motor nerve, your cranial nerve 4, your trochlear nerve, and your cranial nerve 6, your abducens nerve are all intact. So now we're going to move on to cranial nerve 5, your trigeminal nerve. So I'm just going to feel along your face. Whenever you feel my hands, go ahead and say touch.
Okay. Touch, touch, touch.
Perfect. And then while I'm here, if you can just open your jaw and close it. And I'll put my hands down here and apply some resistance. If you can open your jaw and close it. All right. So your cranial nerve 5, your trigeminal nerve is intact. Okay, now I'm gonna do your cranial nerve 7, your facial nerve. So if you can smile, and then can you frown, and then can you put a bubble in your cheeks. All right, your cranial nerve 7, your facial nerve is intact. So now we're gonna do cranial nerve 8, your vestibular cochlear nerve. So if you can go ahead and I'm just gonna whisper a few things in either of your ears. So once I'm done, if you can just repeat those words back to me.
Red, white, blue.
Perfect. And now the other side.
Red, white, blue.
Great. Okay. And now if you can go ahead and stand up for me. We're just going to test your balance. So if you can put your feet together and arms at your side and then close your eyes. So I would just sit here, look for any swaying, anything like that, and we would assess this for 1 full minute. You can have a seat. Okay, your cranial nerve 8, your vestibular cochlear nerve is intact. Okay, now we're gonna have a look inside your mouth again. First, if you could stick up your tongue and say ah. All right, perfect. And then open your mouth one more time. I'm just gonna have a look inside. All right, your uvula is midline. And then you can stick your tongue out, and then you can put it back in your mouth and press it along either side of your cheek. Great. And then if you can swallow again for me. All right. And then I'm taking my tongue depressor, and I would press it against your tongue and check for your gag reflex. The gag reflex is present. So that means your cranial nerve 9, your glossopharyngeal nerve, your cranial nerve 10, your vagus nerve, and your cranial nerve 12, your hypoglossal nerve are intact. Okay, next we're going to check your cranial nerve 11, your accessory nerve. If you can just shrug your shoulders for me. All right, and now I'm going to do it again with some resistance. I can shrug your shoulders one more time. Great. Okay, that means your cranial nerve 11, your accessory nerve is intact. Okay, now we're going to assess your gait. So if you can stand up, and you can turn towards me, and then if you can walk 3 steps heel to toe towards me. All right, and now still facing me, can you do 3 steps heel to toe backwards? Awesome. All right, you can go ahead and have a seat. Your gait is normal. And then next we're going to test your upper and lower cerebellum. So if you could stick your hands out and then flip them back and forth as fast as you can. All right, your upper cerebellum is intact. Next we're going to do the heels to shin test. So taking one of your feet, can you put it to your knee and then rub it down your shin? Awesome, and then with your other foot as well. Perfect. All right, that means that your lower cerebellum is intact. Okay, so now I'm just going to inspect your chest. So, okay, so I'm just looking at your chest just to see if your respirations which are even and unlabored. There's an even rise and fall, and you're not using your accessory muscles to breathe. Okay. And then I'm just going to feel along your skin right here. Everything is warm, dry, symmetrical. And then I'm just going to assess for your skin turgor here, which is normal. Okay. Okay, so now we're going to check your range of motion on your arms. So if you can lift your arms all the way up. All right, and you can put them back down. And then if you can do it again with some resistance. All right. And then if you could lift your arms up like this. And then we're going to do it again with some resistance. All right. And then now I am just going to feel for your radial and brachial pulses. So if you could give me your hands. And I'm just going to turn them this way. First, I'm feeling for your radial pulses, which are +2 equal bilaterally. And then your brachial pulses, which are +2 equal bilaterally. All right. And then we are going to check your reflexes. So you can go ahead and face forward. So go ahead and actually stand up. This is where we're going to do one standing. Okay. So if you could just try to be as limp as you can. So we're going to check your tricep reflex. All right. And then if you could just relax your arm again as much as you can. We're going to check your bicep reflex. And then your brachioradialis reflex. All right. Reflexes are present, and then you can have a seat. And then try to dangle your feet as much as you can. And then I'm going to check your patellar reflex, which is present. Okay. And then if you could give me your hands again, I'm just going to check the capillary refill on your fingers. All right. Cap refill is less than 3 seconds. Okay. So next, we are going to listen to your lungs. So can't focus on it. Yeah. I think it's lungs. Okay. So I'm just going to listen to, no, it's heart sounds. I'm going to listen to your heart. So, using the diagram of my stethoscope, I'm just going to listen first to your aortic valve, which is the second intercostal space on the right sternal border, and S2 is louder. Then I'm going to listen to your pulmonic valve, which is your second intercostal space left sternal border, and the S2 is louder. Then, using the bell of my stethoscope, I'm going to listen to Erb's point, which is the third intercostal space left sternal border, and S1 and S2 are equal. Then back to the diaphragm. I'm going to listen to your tricuspid valve, which is your fourth intercostal space left sternal border, and S1 is louder. And then I'm going to listen to your mitral valve, which is your fifth intercostal space mid-clavicular line, and S2 is louder. And then Kylie, if you could just lean forward for me, I would listen to your apical pulse for 1 full minute, and then I'm just going to feel on your carotid artery right here, just checking for any pulse deficit, and there is no pulse deficit. Okay. Okay, so now I'm going to listen to your lungs. Okay, so if you could turn and face that way, try to get your back towards the wall. Okay. So, whenever you feel my stethoscope along your back, if you could take a deep breath in. Okay. So, 1. 2. Kyler. And then if you can cross your arms on your chest. And then I am going to listen to your lateral breath sounds, which is going to be 3 locations on your right side. And then it's going to be 2 locations on your left. Alright. And then you can face forward again. And now I am going to listen to your lungs in your front. So same thing. When you feel my stethoscope, take a deep breath in. Okay. Okay. Perfect. Alright, your respirations are even and unlabored. Okay, so now what I'm going to do is I'm going to place my hands kind of at the bottom of your ribs and I'm just going to feel how you're breathing. So once I put my hands here, now if you can take a deep breath in. Perfect. Alright, and then you can go ahead and lay down. I'm going to listen to your abdomen. And we would do this normally on bare skin. Alright, so first I'm just inspecting the abdomen. It is symmetrical, there are no lesions and no distension present, and the abdomen is flat, and the color is appropriate for his ethnicity. Alright, Kyler, so I am just going to listen to your vowel sounds, starting in your right lower quadrant. And I would listen for 1 full minute. Then your right upper quadrant, left upper quadrant, left lower quadrant. And if I didn't hear any vowel sounds, I would listen again for an additional 5 minutes. Alright, and then next I'm going to percuss. So, starting again at the right lower quadrant, tap, tap, right upper, left upper, left lower. Alright, all normal. And then I'm going to feel around on your abdomen. So if at any point it's tender, let me know.
Okay.
Starting at the right lower quadrant. Anything?
No.
Right upper?
No.
Left upper?
Mm-hmm.
And left lower?
No.
Perfect. Alright, and then I'm going to just listen really quick for your aorta to see if there are any roots using the belt of my stethoscope. Alright, there are no roots present. Okay, so next we are going to your legs. So just taking a look at your legs, they are even, they are symmetrical, the color is appropriate for the ethnicity. I'm just going to feel, you can point your toes up for me. Just feeling for the temperature. The skin is warm and intact. And then I'm going to check for any edema, starting here at your feet, your ankles, and then your shin. Alright, there is no edema. Okay, now we're going to check your range of motion on your legs. So if you can try to bring your knee to your chest. Alright, and your other leg. Okay, and now if you can do it again, using while I apply some resistance. Alright, and this one. Perfect. Alright, now we're going to do the same thing on your feet. So if you can press down like you're pressing the gas pedal. Alright, and back to normal. And now do it again while I have some resistance. Great. And now if you can try to point your toes to your head. Great. And then again with some resistance. Okay, perfect. Then next I'm going to feel for the pulses on your feet. I'm gonna check for your dorsalis pedis pulse here on the top, which is +2 equal bilaterally, and then your posterior tibialis pulse, which is +2 and equal bilaterally. All right, and then the last thing I'm going to do is feel for the cap refill on your toes. All right, and it is less than 3 seconds, so it's normal. All right, and that's it. Okay, and then here is my final 360 of the room. All right.